right? Really quickly to finish off the kidney, right? So I'm not going to belabor this. We should know our numbers, but they give us our ranges, so you don't have to memorize them anymore, right? But there are some key things that you should still keep in mind with fluid balance deficit, right? Just knowing what causes it, how do you rectify it, right? So obviously, what is going to cause deficit? People throwing up, suctioning, diarrhea, that kind of thing. What's going to cause overload? Well, the heart not working properly, or them being given fluids, right? Those are some main things. Okay. Either way, it's going to affect cognitive. It's going to affect the kidneys. It's going to affect cells, because it's affecting blood, and blood goes everywhere, right? So depending on what signs you see will tell you what the cause is and how to intervene. Okay. All right. So of all the electrolytes, I feel like, obviously, they always tell you, remember everything. But in my head, like the ones that I feel like, remember everything, but start here, right? Start with potassium, right? So hypokalemia, hyperkalemia. Again, the numbers you don't need to know, but you don't need to memorize. They'll give it to you. But what is the most important thing that connects to potassium that we need to know? The heart, right? So anytime we have potassium issues, it affects muscles, it's going to affect the heart. And remember, we connect potassium and hydrogen, right? Because anytime potassium is released, there's going to be hydrogen being released with it. Whenever, hydrogen, when we think of hydrogen, we think of what? Acid-base balance, right? So anytime there's an acidosis of some sort, like in metabolic acidosis. Yes, thank you. I'm thinking of diabetes, but it won't come out. So like something like that, where we have to give insulin, right? When we're giving the insulin, because it's affecting the hydrogen, because acids give up hydrogen, remember with chemistry? So then we're also monitoring our potassium, right? So like anything that's connected to hydrogens, we're connected with potassium, muscles, potassium. So those are some of the things that you have to remember. And since it's so the heart is so important, and potassium affects the heart, we have to monitor it very closely, right? So when you're giving it, you have to know, okay, how much am I giving? The person has to be on a heart monitor, right? That kind of thing. So that's the thing to know, remember mostly about potassium. So the next one after that, I would say to remember, is calcium. And so the one thing too, as you study, always think about when they can question you. When one question can test your knowledge on multiple things, you need to remember that, right? So we mentioned potassium. Potassium is connected to diabetes. It's connected to cardiac issues, right? That's like two different systems connected in pancreas and heart, two different organs they can see your understanding about. So they're definitely going to throw a question in there. Same thing with calcium. When we think of calcium, what does calcium connect to? It also connects to muscles. Same way with potassium. We have the calcium channels with the calcium potassium pump that affects the heart. So when calcium increases, it's going to affect muscles, right? And so now the key things, I put little arrows so you can kind of remember, it's the irritability. Since it affects the muscles, it's going to cause contractions, right? And so irritability, and that second arrow there, well, actually the third arrow, but the only one pointing to something, is the Trousseau's and chaff deck, right? So that, what is that? They put that blood pressure cuff on you and your hands go like this. Or they touch your cheek and you twitch, right? That's twitching. That has to do with muscles. That's calcium for you. Now, the other reason why it's important is calcium is also affecting which other organ other than muscles of the heart, that kind of thing? Thyroid, right? So we need vitamin D to absorb calcium that goes to our parathyroid. So when we talk about the adrenal gland and all these things and how they affect the pituitary gland, that affects the parathyroid. That's another way they can figure out, oh, she understands or he understands about the hormones that affect all of these things, right? So calcium is important. If we affect the parathyroid, it doesn't absorb calcium. It's going to cause hypocalcemia, which is going to cause twitching, chaff, neck, trousseaux. So calcium is one to remember. Okay. The other thing to remember about calcium is when it's low or when it's high, what do we give medication-wise, right? So remember, and this is how I tell people to remember it. So hypocalcemia means low calcium, right? So we give, when it's low, we give the medicine that has 2 words in it, calcium gluconate, because there's less of it, so we need to give, I say, okay, a bigger pill or something like that. Calcium gluconate because it's low. But when it's too much and we need to break down the calcium, we need to give calcitonin. It's only 1 word because it's already too much. So just give one pill, right? In my head, that's how I try to remember which one do I give for which, right? And remember, where does calcium go? It helps strengthen the bones, right? So calcium also will affect people with kidney stones. So that's another thing that calcium is connected to. So you see, so many organs. So there's going to be some kind of question connected to calcemia, hypo, or whatever. So just take a note of how they're connected, right? So the other one is magnesium. Now, magnesium, if you remember, so the way I try to remember things is I associate them, right? So I say magnesium and calcium have similar things happen to them. If I remember calcium, I don't need to remember magnesium because they're almost the exact same thing. Hypocalcemia causes twitching and muscle spasm stuff. Magnesium, hypomagnesium, does the same thing, and vice versa. Tendon reflexes, that kind of thing. So hypomagnesemia will cause twitching, chaff, neck, trousseaux. But the one that we worry about the most is the hyper, right? So we're going to give, so do you remember the time when you gave magnesium gluconate? Do you remember that? When did we give magnesium gluconate? Pregnancy and seizure, yes. So with pregnant women, we gave it. Why? Because not the seizures, we wanted to stop contractions. What is a contraction? It's a muscle spasm, right? So it makes sense. Yes. Magnesium sulfate. What did I say? Gluconate. My fault. Magnesium sulfate. What did I write down? Magnesium sulfate. I wrote it down. Sorry. Thank you for catching that. Magnesium sulfate, right? So when we give magnesium sulfate, we're giving it because we want to decrease the contractions. The woman is about to be in labor. We want her to slow down labor. So we want to stop contractions. So we see here is the twitching. So that one's low. That's not the one. It's when it's high that it's going to cause a contraction. So that's something that we have to remember to see, okay, magnesium, it has to do with contractions. Oh, that pregnant woman. So and remember, like, if you don't have to remember when to give it specifically, just remember the scenario, and that's easier, right? If you know I give magnesium sulfate, which is giving extra magnesium, to a pregnant woman who has contractions, then I know that's the connection, right? Okay, so the next one, hyponatremia, not as big, but definitely if you have too much salt, we know that's connected to hypertension, that kind of thing, right? Headaches, confusion, seizures, right? Okay, with the fluid balance, just going back, knowing if we have fluid, we're going to have lung issues, kidney issues, skin issues. We remember our pHs. We got to remember our numbers that they're not going to give us. We need to know and memorize those, right? We talked already about blood gases and the levels for the adults and babies. You don't have to remember the numbers mostly. Just know that any fluid shift is going to affect older adults and little babies mostly, right? And that's it, okay? Oh, I think I repeated it all that. Okay, so that was just a little end there for the kidney.